Ladies and gentlemen, good evening. I want to begin today with a simple but powerful question. What if you take magnesium at night? I'm not here to sell you supplements. I'm here as your doctor to help you understand your body better and unlock what may be one of the most overlooked keys to healing, energy, and deep restorative sleep. Let's start with the facts. Magnesium is involved in over 300 biochemical reactions in your body. Think about that. It regulates muscle and nerve function, blood sugar levels, blood pressure, and it plays a critical role in producing energy and supporting your immune system. But here's the twist: when you take magnesium matters. And taking it at night could be a game changer for your health. When patients come into my clinic and say, Doctor, I'm exhausted all the time, but I just can't sleep, I know we need to look beyond just sleeping pills or white noise machines. One of the first things I ask about is their magnesium intake, especially in the evening hours. You see, magnesium plays a central role in how your brain and body transition into rest. Without enough of it, your entire sleep system is compromised, even if you go to bed at the right time or have a perfect mattress. Magnesium is a natural relaxant. It doesn't sedate you like a sleeping pill, but it helps your body do what it was built to do: calm down at night. It interacts with neurotransmitters in the brain, particularly GABA, gamma aminobutyric acid, which is your body's main inhibitory neurotransmitter. Think of GABA as the brake pedal in your nervous system. It slows things down. It's what helps you move from a stimulated, alert state into a calm, restful state. Magnesium enhances GABA activity, helping your brain shift out of stress and into recovery. It's important to understand that sleep isn't just the absence of wakefulness. Sleep is an active process. Your body uses this time to repair damaged cells, regulate hormone levels, consolidate memory, and remove waste from the brain through a system called the glymphatic system. For all of this to happen, your nervous system needs to quiet down. Magnesium is one of the most powerful tools nature gives us to support this transition. Patients who are deficient in magnesium often report difficulty falling asleep, frequent awakenings during the night, and light, non restorative sleep. They may go to bed for 8 hours but wake up feeling like they haven't slept at all. That's not insomnia, that's inefficient sleep physiology, and magnesium often sits at the center of the problem. Now, why take magnesium at night? Because this is when the body is naturally shifting into parasympathetic dominance, the rest and digest state. This is the opposite of the fight or flight stress response that dominates your day. Taking magnesium in the evening supports this natural shift, helping smooth the transition into deep restorative sleep. It does this gently, gradually, and most importantly, without dependency. Unlike pharmaceutical sleep aids, magnesium doesn't knock you out. It enables your body to fall asleep on its own. And it's not just about falling asleep, it's about staying asleep. One of the lesser known effects of magnesium is its ability to reduce nocturnal awakenings. These are the wake ups at 2 or 3 a.m., where you find yourself staring at the ceiling, your mind racing, your heart slightly elevated. Magnesium stabilizes the nervous system, maintains muscle relaxation, and helps prevent this disruption by keeping cortisol levels in check at night. Cortisol, your main stress hormone, should naturally decline in the evening, but without magnesium, that curve doesn't drop as it should. Clinical research has also backed this up. Several randomized controlled trials show that magnesium supplementation can improve sleep onset, total sleep time, and sleep efficiency. In older adults, magnesium has been shown to reduce the time it takes to fall asleep and increase time spent in slow wave sleep, the deepest, most restorative phase of sleep. That's the phase where your body repairs tissues, builds bone and muscle, and strengthens the immune system. The bottom line: magnesium is not just a nice to have, it's a biological requirement for effective sleep. Taking it at night takes advantage of your body's natural rhythms, boosts your ability to fall into deep rest, and ensures that your time in bed is actually productive, not just hours passed, but healing achieved. If you're someone who lies awake wishing for rest, or you wake up more tired than when you went to bed, consider this. Maybe your body isn't broken, maybe it's just missing magnesium. One of the most common yet under-addressed complaints I hear from patients, especially those over 40, is this: doctor, I keep waking up in the middle of the night with muscle cramps. My calves feel like they're on fire. It's affecting my sleep and I don't know what to do. Another variation is I get this twitching in my legs when I try to relax. It's like my body won't turn off. These symptoms often point toward a hidden deficiency in a mineral that's crucial for muscular function: magnesium. Magnesium plays a fundamental role in the way your muscles contract and relax. Most people are aware that calcium is necessary for muscle contraction, but few realize that magnesium is just as critical for the opposite function: muscle relaxation. Without enough magnesium, your muscles remain in a more contracted state, which can lead to tightness, stiffness, spasms, and painful nocturnal cramping. These are not just minor annoyances, they are signs of neuromuscular imbalance. What's especially interesting and concerning is that these symptoms often appear or intensify at night. Why is that? At night, your body's electrolyte balance naturally shifts as it prepares for rest and recovery. Your muscles, which are in a repair phase during sleep, require sufficient magnesium to relax and restore. If your levels are too low, those muscles begin to misfire, leading to involuntary contractions and cramping that can pull you out of deep sleep or prevent you from getting there in the first place. This is where nighttime magnesium supplementation can be particularly powerful. By taking magnesium in the evening, you're ensuring that your bloodstream has a steady supply available when your muscles are most in need of repair and relaxation. In particular, forms like magnesium glycinate and magnesium citrate are highly bioavailable and well tolerated by most individuals, making them ideal for calming tense muscles and soothing the nervous system before bed. And it's not just about cramps. I also see a number of patients suffering from restless leg syndrome, RLS, a condition where the legs feel jumpy or uncomfortable during periods of inactivity, especially in the evening. Magnesium has shown great promise in alleviating RLS symptoms, primarily because of its calming effect on nerve transmission and its ability to reduce involuntary muscular activity. In other words, it tells your nerves and muscles it's time to rest now. Athletes and people who exercise regularly are especially vulnerable to magnesium depletion. Physical activity increases magnesium loss through sweat and urine. Without adequate replenishment, especially before sleep, the body may experience increased soreness, prolonged recovery times, and more frequent nighttime muscle discomfort. Magnesium taken at night can significantly reduce delayed onset muscle soreness (DOMS) and improve overall muscle recovery by relaxing tight fibers and lowering inflammation in the tissue. Even if you're not an athlete, magnesium's ability to ease musculoskeletal tension can help with general stiffness and tightness that accumulate from stress, poor posture, or sedentary lifestyles. Think of it as a natural muscle relaxer, one that doesn't require a prescription and doesn't come with drowsiness or dependency. It's gentle, physiological, and works with your body's own healing processes. What's more, by improving muscle relaxation and reducing nighttime pain, magnesium indirectly improves your sleep quality, which in turn supports better hormonal balance, mental clarity, and energy levels during the day. The ripple effect is enormous. When your muscles are allowed to relax fully, your entire body enters a more parasympathetic restorative state. That's when real healing begins. If you're waking up with tightness, cramps, or tension, or if you find yourself tossing and turning because your legs just won't settle down, it might not be just old age or bad luck. It might be a signal that your body is screaming for something simple: more magnesium. By taking it at night, you're giving your muscles the one thing they need most: permission to let go. When we talk about stress and anxiety, most people immediately think of therapy, meditation apps, or prescription medications. And while those tools can be helpful, we often overlook one of the most basic biological supports your body needs to manage stress effectively: magnesium. As a physician, I've seen time and again that addressing nutrient deficiencies can shift a patient's mental and emotional state in powerful ways. Magnesium is one of the first I look for, especially in people struggling with evening anxiety, racing thoughts at bedtime, or chronic tension that just won't release. Magnesium has a calming effect on the nervous system. In fact, we often refer to it as the body's anti stress mineral. It plays a central role in regulating the hypothalamic pituitary adrenal HPA axis, which is your body's primary stress response system. When you experience stress, whether it's physical, emotional, or psychological, the HPA axis is activated, leading to the release of cortisol, your main stress hormone. Magnesium helps modulate this response, ensuring that the system doesn't become overactive or stay on longer than it should. Now, here's where timing matters. When you take magnesium at night, you're giving your body a much needed resource to dampen that stress response before bed. That means less tossing and turning, less lying awake rehashing conversations, less 2 a.m. worry about things you can't control. Magnesium helps put a physiological brake on the anxiety loop. Biochemically, magnesium works by binding to and activating GABA receptors in the brain. GABA, gamma aminobutyric acid, is your brain's primary calming neurotransmitter. It counteracts excitatory brain activity and is essential for quieting the mind, relaxing the body, and preparing for sleep. If your GABA levels are too low, or if your magnesium levels are too low to activate those receptors, then your brain remains in a heightened alert state. This is where many people get stuck. Their body is tired, but their mind won't stop. It's not just in their head, it's in their chemistry. Taking magnesium at night enhances your natural GABA activity, creating a sense of calm, clarity, and control. Many patients report that they feel less wired, less irritable, and more emotionally balanced within just a week or two of consistent supplementation. This isn't placebo, it's cellular regulation. It's your nervous system finally getting what it needs to shift into a restorative mode. Another crucial point is magnesium's effect on cortisol rhythms. Ideally, cortisol should be high in the morning, helping you wake up, and low in the evening so you can wind down. But in people with anxiety, burnout, or chronic stress, that rhythm is often flipped or flattened. Magnesium helps normalize this curve, reducing evening cortisol levels and allowing melatonin, the sleep hormone, to rise properly. It's also worth noting that magnesium is rapidly depleted during times of chronic stress. Every time your body goes into fight or flight mode, it uses up more magnesium to regulate that response. That means the more stressed you are, the more magnesium you lose, and the harder it becomes to stay calm. It's a vicious cycle. Stress depletes magnesium, and low magnesium increases stress sensitivity. By taking magnesium at night, you're breaking that cycle in a way that's gentle, safe, and sustainable. For patients with generalized anxiety, panic attacks, or even low grade irritability and mood swings, magnesium is often the missing link. And because it works at a foundational level, regulating neurotransmitters, hormones, and muscle tension, it doesn't just mask symptoms, it supports true nervous system resilience. So, if you're finding it hard to shut off your thoughts, if you're carrying tension in your chest or gut late at night, or if you're waking up tired because stress is stealing your sleep, I urge you to consider this. Maybe your body doesn't need another stimulant in the morning. Maybe it needs magnesium at night to restore the calm your brain has been searching for all day. When we think about heart health, the conversation typically revolves around cholesterol, blood pressure, exercise, and diet. And when we talk about mental health, most people immediately think of serotonin, dopamine therapy, or antidepressants. What often gets overlooked is the profound influence a single mineral can have on both systems, your cardiovascular system and your brain. That mineral is magnesium, and it plays a dual role in protecting both your heart and your mind. And the timing of when you take it, particularly at night, can significantly enhance its effectiveness. Let's start with the heart. Magnesium is essential for the electrical conduction system that governs your heartbeat. Each time your heart contracts and relaxes, a carefully regulated dance of electrolytes, magnesium, potassium, calcium, and sodium takes place. Magnesium helps stabilize the rhythm and prevents erratic electrical activity. This is why low magnesium levels are often associated with arrhythmias such as premature heartbeats or atrial fibrillation. I've seen patients with unexplained palpitations or nighttime fluttering in their chest that dramatically improve after restoring magnesium levels. Magnesium also helps relax blood vessels, which lowers resistance and reduces blood pressure. This is crucial, particularly for people dealing with hypertension or vascular tension that spikes at night. By supporting vasodilation, the widening of blood vessels, magnesium reduces the workload on the heart and improves blood flow to critical organs, including the brain. Taking magnesium at night allows this relaxation process to align with the body's natural wind down, further supporting a calm cardiovascular state as you enter deep sleep. Now, let's talk about the brain, your body's most energy demanding organ. Magnesium plays a central role in regulating neurotransmitter activity, maintaining synaptic plasticity, and even protecting neurons from damage. One of the most underappreciated functions of magnesium is its ability to block NMDA receptors when necessary. These are receptors in the brain responsible for excitatory activity. When they're overstimulated, as happens in anxiety, stress, or neuroinflammation, brain cells can become damaged or burnt out. Magnesium serves as a natural gatekeeper, preventing excessive stimulation and shielding the brain from long-term wear and tear. That's why magnesium deficiency has been strongly linked to increased risk of depression, anxiety, and even cognitive decline. Multiple studies have shown that individuals with low magnesium levels are significantly more likely to suffer from mood disorders. And in my clinical experience, it's often the patients with mystery fatigue, chronic irritability, or brain fog who are the ones most depleted in magnesium. What happens when you take magnesium at night? For one, it supports the natural evening decline of cortisol, your stress hormone. This shift allows for the rise of melatonin, but it also allows the brain to transition into a more neuroprotective, anti-inflammatory state. Brain repair, memory consolidation, and emotional regulation are all processes that take place during sleep, and magnesium helps ensure those processes unfold smoothly. Moreover, magnesium influences the parasympathetic nervous system, the part of your nervous system responsible for rest, digestion, and repair. When you take magnesium in the evening, you give your brain and heart the signal to slow down, repair, and regulate. Patients often describe this as a subtle shift. Their heart feels more stable, their mind quieter, their anxiety less reactive, and over time that shift accumulates into better emotional resilience, sharper cognition, and improved cardiovascular health. We need to move beyond the idea that heart and brain health are isolated systems. The truth is, they are deeply interconnected. And magnesium is one of the few interventions that addresses both at a root cause level. When you take it at night, you're aligning its powerful effects with your body's natural rhythm of healing. You're not just supplementing, you're supporting two of the most vital organs in your body, the ones that think and feel, beat and breathe, and carry you through every day of your life. One of the most overlooked yet powerful aspects of nighttime healing is your body's ability to regulate inflammation. Inflammation, at its core, is not inherently bad. It's a natural response designed to protect and repair. But when inflammation becomes chronic, silent, and systemic, it becomes the root cause of nearly every major health problem we see today: heart disease, obesity, diabetes, arthritis, autoimmune disease, even depression. What many people don't realize is that magnesium is a frontline regulator of this inflammatory process, and taking it at night can be one of the most effective ways to support that regulation, while your body is already trying to repair and restore. Let's talk physiology. Every night, your body shifts into a recovery mode. Cells repair damage, hormones rebalance, and the immune system quietly clears out waste and resolves inflammation. This is not passive rest, it's active, sophisticated biochemistry. And magnesium is essential to every step of that process. Magnesium helps reduce the production of pro inflammatory cytokines, the signaling molecules that trigger and sustain inflammation. When magnesium levels are low, your immune system becomes more reactive, more sensitive to perceived threats, and more likely to stay in a heightened alert mode even when it shouldn't. Over time, this can lead to low grade chronic inflammation that wears down tissues, damages joints, stiffens arteries, and contributes to fatigue, brain fog, and pain. By taking magnesium at night, you give your immune system what it needs during its natural anti inflammatory window. Sleep itself is anti inflammatory, but only when it's deep and uninterrupted. Magnesium helps you not only achieve that state, but also enhances the cellular work happening during it. It supports antioxidant pathways, reduces oxidative stress, and promotes mitochondrial function, all of which are vital for reducing internal damage and enhancing healing. This is especially important for individuals struggling with conditions like fibromyalgia, arthritis, chronic fatigue syndrome, or autoimmune disorders. These patients often wake up feeling sore, achy, and inflamed despite getting 7-8 hours of sleep. That's because the body is not fully entering the restorative phases of sleep, or it's lacking the necessary cofactors to calm the inflammatory process during rest. Magnesium provides that missing support. It relaxes tight muscles, eases nerve tension, and lowers the stress hormones that interfere with anti inflammatory repair. Athletes too benefit immensely from nighttime magnesium. After a workout, your body doesn't actually grow stronger during the exercise, it grows stronger during the recovery. This includes repairing micro tears in muscle fibers, reducing inflammation in joints, and replenishing cellular energy stores like ATP. Magnesium is involved in every single one of those functions. It acts as a cofactor in ATP production, making it indispensable for energy restoration and tissue healing. Without it, recovery is compromised, leading to increased soreness, slower repair, and reduced performance over time. There's also a fascinating relationship between magnesium and gut health, which plays a major role in inflammation. A healthy gut barrier prevents inflammatory toxins from leaking into the bloodstream. Magnesium helps maintain that barrier and promotes the growth of beneficial bacteria, many of which are active during your sleep cycle. Taking magnesium at night may therefore contribute not just to inflammation reduction but also to better digestion, nutrient absorption, and overall immune balance. Lastly, we must understand that healing is rhythmic. The body follows a circadian pattern for repair, and inflammation has a rhythm too. It tends to spike in the early morning hours. By supplying magnesium before you go to bed, you help blunt that spike and support a smoother overnight recovery curve. You're not forcing the body to do anything unnatural, you're simply giving it the tools it's already looking for. In my practice, I've seen profound improvements in patients who begin magnesium supplementation at night, not just in how they sleep, but in how they wake up with less stiffness, fewer headaches, improved energy, and a clearer mind. And that's the real power of this mineral. It doesn't just help you feel better overnight, it sets the tone for a healthier, less inflamed body throughout the next day. One of the most important principles in medicine and in biology as a whole is that timing matters. We've known this for decades. Your body runs on a circadian rhythm, a 24-hour internal clock that regulates everything from hormone production to digestion immune response, and cellular repair. This rhythm isn't just about when you wake up or go to sleep, it governs the very foundation of how your body heals and functions. When you take a supplement, especially something as powerful and multifunctional as magnesium, aligning it with your body's natural rhythm can significantly enhance its effectiveness. That's why taking magnesium at night isn't just convenient, it's strategically therapeutic. Magnesium is deeply involved in processes that peak during the evening and overnight hours. For example, your parasympathetic nervous system, the rest and digest branch, becomes dominant at night. This system slows your heart rate, lowers blood pressure, calms brain activity, and promotes digestion and repair. Magnesium supports parasympathetic tone, which means it helps your body fully shift into this rest oriented mode. Taking it at night reinforces that shift, helping your body move more efficiently from activity to restoration. Additionally, levels of melatonin, your sleep hormone, begin to rise as darkness falls. Melatonin production relies on the proper functioning of your pineal gland and depends on a quieted nervous system. Magnesium not only enhances melatonin secretion but also reduces the interference of cortisol, your stress hormone. When magnesium is taken in the evening, it naturally supports the decline in cortisol and rise in melatonin, making it easier to fall asleep and stay asleep through the night. Another crucial point: cellular regeneration and immune function peak during deep sleep, particularly in the early hours of the night. During this time, your body is focused on repair. It's fixing tissues, clearing metabolic waste, repairing DNA, and restoring energy at the mitochondrial level. Magnesium is a cofactor in all of these functions. It's required for ATP production, the fuel source of every cell, and it facilitates over 300 enzymatic reactions in the body. Taking it at night ensures that your cells have the raw materials they need right when they're working hardest to repair and rebuild. The rhythmic nature of magnesium's absorption and utilization is also important. Studies show that magnesium levels in plasma can fluctuate based on the time of day, often dipping at night when the body is using more of it for recovery processes. If you're not replenishing it in the evening, your body may fall short during a critical window. By supplementing at night, you're helping to fill that dip, stabilize magnesium levels during the sleep cycle, and optimize overnight function. This alignment with your natural rhythm also improves how you feel the next day. Patients often report waking up with more clarity, better energy, fewer mood swings, and less tension. Not because the magnesium acts like a sedative, but because it allowed the body to complete the restorative tasks it's designed to do. You're not overriding your biology, you're working with it. Moreover, certain symptoms like nighttime anxiety, leg cramps, palpitations, or racing thoughts often strike during the late evening when magnesium is already low. This isn't a coincidence. Your body is giving you signals. It's telling you when it needs support. Instead of responding with stimulants in the morning or sleep aids at night, we can take a more intelligent approach by understanding when the body is asking for what. The bottom line is this: health is not just about what you take, it's about when you take it. Taking magnesium at night is about respecting the body's natural cycles and supporting them in the most efficient way possible. In my clinical experience, this simple shift in timing often leads to profound changes in sleep quality, energy levels, emotional balance, and overall well being. It's not magic, it's biological alignment. And sometimes that's the most powerful medicine of all.